I have been pleading for consumer price transparency in healthcare. We took the first step. New regulation that went into effect yesterday that, near as I can tell, is not really being complied with yet. It mandates that medical service providers provide cost transparency for basic procedures. Now, there's a lot of room for interpretation. Again, this isn't necessarily being adhered to, but here to talk more about the implications from GDP Advisors, someone who gets it, Seth Denson. Happy New Year, Seth. How you doing?
Brian, Happy New Year to you, my friend. Doing well. Thanks for having me back on.
Yeah, you bet. So we do have this new regulation that mandates that medical service providers have to provide some pricing for basic procedures online. What are you seeing so far, and what do you think the implications could be here?
Well, listen, I'm going to echo your point. I was thrilled when this rule came out. Now, this has been talked about since April, so this shouldn't have come as a surprise to hospitals, but somehow it did, because not very many have complied thus far, at least that from what we can tell. That said, this was a great first step. It's not the last step, though. But as you and I have talked about many times, as you said just a moment ago, pricing transparency is the first step to allowing our consumer-driven system to work properly, and it is consumer-driven system that will solve healthcare in the United States.
So as we get this ball rolling with hopefully the medical service providers complying in short order, do you think that there are loopholes in this based on what you're seeing? For example, if they have to provide for basic procedures, the cost, I think the language is actually standard procedure. Will there be like a technicality, for example, where it looks like it's going to cost a certain amount, you plan on that, then you go there, and they say, well, you're not standard?
Well, there's no doubt that there's some loopholes here, and as this all kind of flushes out over time, we're going to start to see those, and here's a few of them. One is that the hospital is effectively posting their pricing, but what a consumer actually pays at the end of the day is based on their insurance provider. So what negotiated discounts that specific provider has negotiated. And it's not as easy as me saying, well, I'm with Blue Cross, this is my discount. Blue Cross has 30 different network contracts. So I have to know what contract that is. And the other piece of this is that in the United States, healthcare operates on what's called fee-for-service, not outcome. What that means is that every person is charged for everything that's done. So I could go in, let's say, for a rotator cuff surgery and come out realizing that, oh, I used 3 boxes of Kleenex, 4 boxes of latex gloves, and 3 aspirin, all of which I was billed for.
For $500.
That's the way that it works. You know, and so this is supposed to be an idea of cost. And listen, what I love about this had to happen. We had to have this step before we could get to full transparency in the marketplace. And I've been advocating for years, too, that a hospital should have to charge based on outcomes, not based on tests as well. Because the problem is we have incentivized the healthcare system to run it up, that tab and to bill for every little thing.
Well, and with so much medicine being defensive because of the threat of lawsuits, for example, aside from any financial motivation, the incentive has been there on the health provider side to do as much CYA testing as they feel is necessary, which I think is all part of the reason why, whether our insurance company is still involved or not, that we at least have an understanding of the cost of a lot of what's going on, because often we don't have any clue. We're just given a bill by our insurance company months down the road that might not make sense to us. So if we take a look at what we have here, you know, one, if you don't have health insurance, this at a minimum should make it easier to be able to become a good consumer of health care, right? Comparison shopping for price, at least between hospitals once it's all up and running.
You know, it should. Here's the challenge, and again, as more and more hospitals start posting these things online, we'll start to see more. But you got to understand, there's almost 70,000 what are called ICD-10 codes in the United States. And what the rule says is that hospitals have to now post those online. There doesn't have to be any search tool. There doesn't have to be any way to disseminate that data. It just has to be out there, right?
Ooh,
so it's going to take some time. Now, I'm sure that there's some brainiac in Silicon Valley that's already working through an algorithm to manage this, right? But for right now, just imagine going online to this hospital, and there's a spreadsheet with all 68,000 codes and what their charge master is for it. So this is a step, but we still have a long way to go.
Well, I kind of thought that was the case, but hey, you got to start somewhere, and at least now we're being given the first shot at becoming better consumers of healthcare and having some type of competition in the marketplace. So I know somebody else who's a smart guy might be able to help folks with all this too, and that would be you and your team there, GDP Advisors. So Seth Denson, pleasure, Happy New Year, and best wishes. We'll talk to you soon.
Thanks, Brian. Happy New Year to you.
All right, and GDPadvisors.com is website now.